Welcome back all of you to Government Nursing Officer Exams Preparation. This is the mock test explanation series part 42 for various central government nursing officer exams. The first question, the outer covering of the heart is option A pericardium, option B mediastinum, option C endocardium, option D pleura. The right answer here is option A pericardium. You can see the diagram here. The outermost layer here is pericardium, then epicardium comes, then the muscular layer of the heart, myocardium, and the innermost layer of the heart will come, that is endocardium. So, pericardium, epicardium, myocardium, and endocardium. This is the order of layers of heart. Next question, the term dorsal in anatomy denotes which of the following? Option A anterior, option B posterior, option C lateral, and option D contralateral. The right answer here is option B posterior. See the diagram here. The posterior is dorsal and anterior is ventral. The upper portion is cranial and the lower portion is caudal. So posterior, anterior, cranial, caudal. Next question, the largest salivary gland in our body. Option A submandibular gland, option B parotid gland, option C sublingual gland, and option D buccal gland. The right answer here is option B parotid gland. You can see the diagram here. The parotid gland is the biggest gland. The other glands are here sublingual gland and submandibular gland. Both these glands are smaller than parotid gland. Next question, the impaired ability to recognize letters or numbers drawn by an examiner's fingertip on the patient's skin is option A agraphesthesia, option B akathisia, option C aphasia, and option D ataxia. The right answer here is option A agraphesthesia. Agraphesthesia is the inability to recognize letters or numbers which is drawn by examiner's fingertip on the patient's skin. Then akathisia is the inner restlessness or inability to stand still. Aphasia is a language disorder which will affect the communication, and ataxia is the balance disorder. It is the inability to balance or coordinate. So remember these four terms with these color codes and short terms so that you can better remember in exams and avoid confusion during exam. Next question, the substance most commonly used to measure GFR, the glomerular filtration rate, is option A inulin, option B glucose, option C albumin, and option D globulin. The right answer here is option A inulin. You make sure that this is not insulin. You should read it inulin. Inulin is considered the gold standard for measuring GFR. It is not always practical in clinical setting due to its complexity. So we are not always considering this due to its complexity, and therefore some markers like creatinine are often used as a substitute. You can see the lab report for creatinine for kidney function or GFR. But inulin is the most commonly used, or it is the gold standard for measuring glomerular filtration rate. Next question, in dengue fever, the vector is option A Culex mosquito, option B Aedes aegypti, option C flavivirus, option D toga virus. The right answer here is option B Aedes aegypti. Here the first two options are two types of mosquito which are vectors, and the second two options like flavivirus and toga virus are the causative organism. So in this kind of questions, you can eliminate the last two options straight away so that you will end up with two options, Culex and Aedes. From that, you have to choose the right answer. How to avoid confusion from these two types of mosquito? This is the memory trick. Culex jap and Aedes MYDCZ. Culex jap is the short form of the disease caused by Culex, and Aedes MYDCZ is the other short form for Aedes. So first let us see Culex jap. Japanese encephalitis, avian flu, and filariasis is caused by the Culex mosquito. Aedes MYDCZ. It's already explained many times, so I will go quickly. It is Mayaro fever, yellow fever, dengue fever, chikungunya and Zika fever. So, Aedes will cause these diseases and Culex will cause these diseases. Malaria is caused by Anopheles mosquito. So, remember this short form to avoid confusion among the mosquito-borne diseases. Many diseases are there for mosquito-borne in nature, so you have to remember the short form. Next question. The hormone that reaches its peak during ovulation is option A FSH, option B progesterone, option C LH, and option D estrogen. The right answer is option C LH. The surge in LH triggers the release of an egg from the ovary, marking the start of ovulation. So this is the LH surge. Next question. A congenital disorder of nasopharynx is option A choanal atresia, option B coccygesia, option C achalasia, and option D cachexia. Let us see the right answer. The right answer here is option A choanal atresia. Choanal atresia is the congenital disorder of nasopharynx. Next question. The innermost coat of eyeball is option A cornea, option B sclera, option C iris, and option D retina. The right answer here is option D retina. You can see the diagram here. The outer coats are sclera and cornea. Then the intermediate coats are iris, ciliary body, and choroid, and the retina is the innermost layer. Remember this diagram for your exam. Next question. The Coombs test is to option A. Assess hip instability. Option B. Assess hip dislocation. Option C. Detect carbohydrate. And option D. Detect antiglobulin. The right answer is Coombs test is to detect antiglobulin. Option D is the right answer here. Next question. All are paired laryngeal cartilages except option A actinoid cartilage, option B thyroid cartilage, option C corniculate cartilage, and option D cuneiform cartilage. The right answer here is option B thyroid cartilage. The laryngeal cartilage that is not paired is the cricoid cartilage. That is the only one cartilage that is not paired. All other laryngeal cartilages, see here, actinoid, corniculate, and cuneiform are paired cartilages. Next question. The interstitial connective tissue that surrounds the liver is option A Kupffer cells, option B Cisterna cheli, option C Glissen's capsule, and option D omentum. The right answer here is option C Glissen's capsule. You can see the outer layer of the connective tissue surrounds the liver, that is Glissen's capsule. Next question. Who invented smallpox vaccine? Option A Louis Pasteur, option B Edward Jenner, option C Robert Koch, and option D Robert Cook. The right answer here is option B Edward Jenner. He is the father of immunology who invented smallpox vaccine, and then the vaccine history or the immunology is derived from this invention. Next question. A projective psychological test in which subjects' perceptions of ink blots are recorded and then analyzed using psychological interpretation, complex algorithms, or both is option A Simon-Binet test, option B Selkovich test, option C Rubin's test, and option D Prasad test. The right answer here is option D Rosar's test. Next question. The generation time for tubercle bacilli is option A 20 minutes, option D 20 seconds, option C 20 days, Option D, 20 hours. The right answer here is option D, 20 hours. The generation time of tuberculosis, specifically mycobacterium tuberculosis, is 12 to 18 hours. So here, the most appropriate answer is 20 hours. All other answers are not appropriate. Next question. A behavioral scale for evaluating post-operative pain in young children is option A, Braden scale, option B, Apgar scale, option C, Cheops scale, and option D, AVP scale. The right answer here is option C, Cheops scale. Cheops scales, you can see the different variable cry, facial, verbal, torso, legs, and score from 0 to 2. So this is the post-operative pain evaluation scale for children, young children. Braden scale, as you know, it is for the bedsore. Apgar is for the newborn assessment. Then AVPU scale is for the level of consciousness assessment. Next question. An example of zoonotic disease is option A, rabies, option B, malaria, option C, measles, and option D, leprosy. The right answer is option A, rabies. Rabies is caused by the rabies virus, which is transmitted by the dog. So this is one of the zoonotic diseases. Next question. Albinism, or the condition in which little or no melanin production, is also called option A, achondroplasia, option B, anisocoria, option C, achromasia, and option D, achalasia. The right answer here is option C, achromasia. Achromasia is the other name for albinism, which is little or no melanin production. Next question. An infection occurs around the ear due to a vector present in that area is called option A, epidemic, option B, endemic, option C, pandemic, and option D, sporadic. The right answer here is option P, endemic. Let us see the different definitions of these terms. An epidemic is a widespread occurrence of an infectious disease in a community at a particular time. The pandemic is an epidemic of an infectious disease that has sudden increase in cases and spread across a large region, for it touches multiple continents. The best example which we know is COVID-19 for a pandemic. Here in endemic, an infection is said to be endemic in a specific population or populated places when that infection is constantly present or maintained at a baseline level. This is the point. So it is constantly present or maintained at a baseline level in a particular area. That is endemic. Sporadic, the infections that occurring occasionally, singly, or in irregular or random instances. That is sporadic. So remember these terms to avoid confusion. Next question. The gland which is also known as hypophysis cerebri is option A, pituitary gland, option B, pineal gland, option C, adrenal gland, and option D, thymus gland. The right answer is option A, pituitary gland. You can see the diagram and the position. It is below the cerebrum. So this term hypophysis cerebri is denoting pituitary gland. Next question. Name the principle in which the part of personality ID operates. Option A, pleasure principle, option B, morality principle, option C, reality principle, and option D, primitive principle. The right answer here is option A, pleasure principle. The part of the personality known as the ID operates on the pleasure principle. This principle dictates that the ID seeks immediate gratification of desires, needs, and impulses without regard of consequence or social norms. Next question. A group of cells, sometimes called non-ciliated bronchiolar secretory cells, found in the bronchiolar epithelium is option A, Clara cells, option B, Kupffer cells, option C, Dieter cells, and option D, mitral cells. The right answer here is option A, Clara cells. You can see the diagram of Clara cells. which is found in the bronchiolar epithelia. Next question. Name the defense mechanism in which instincts are channeled instead of being blocked. Option A, compensation. Option B, sublimation. Option C, repression. Option D, regression. The right answer here is option B, sublimation. Sublimation in psychology is a defense mechanism where unacceptable impulses or desires are transformed to socially acceptable behaviors. For example, an angry man, he channels his emotions or aggression in sports, which is a socially acceptable form of his transformation of emotions. So this is sublimation. Other defense mechanisms like compensation, repression, regression, I have already discussed in many videos multiple times. So to save time and avoid repetition, I am not going to explain that. Please refer my previous exam preparation videos if you need to get more description on the other defense mechanism. Next question. Tuberculosis, spondylitis or TB of spine is option A, Pott's disease, option B, Paget disease, option C, Koch disease, and option D, Still's disease. The right answer here is option A, Pott's disease. So tuberculosis spondylitis is also known as Pott's disease or TB of spine. Next question. This is the last question of this series. What is psychology of human behavior concerned with? Option A, studying physical health. Option B, understanding social interactions. Option C, analyzing mental process and behavior. Option D, all the above. The right answer here is option C, analyzing mental process and behavior. So with this question, we are winding up this session. Thank you all for watching this video. Please add your valuable feedback and like, share and subscribe for more exam preparation videos which are on the way. Thank you so much.